Good morning. It's June 2nd. Yesterday I was at the Academy of Veterinary Imaging in Arlington, Texas on a scan-only soft tissue for dogs and cats. In my previous video, I was explaining to my fellow sonographers, growing my practice, I have considered imaging dogs and cats, abdomens, pelvic, but abdomens are considered all together, pelvic and abdomen. So I'm going to do that to expand my practice, and that's the main reason I went. Plus, my angles of incination were pretty much unknown to me, even though I can look around. And there were three very difficult areas that I noticed straight away within the first couple of hours, and that is adrenals and pancreas for both dogs and cats. It's a little intimidating at first because they're difficult. I worked hard on those three areas, and by the end of the day I was very comfortable and confident that I can pick them up most of the time, all of them, those three difficult areas, except for the right adrenal, where sometimes it's probably going to be obscured. I don't really feel like the anatomy was much of a challenge for us. We understand the liver and the pancreas. It's a little bit different, as far as size and shape, but we're not confused by their anatomy. I did send out 40 pieces of marketing prior to going to this course. I probably should have waited until after completing the course and getting the certificate, and then my marketing would have talked about the adrenals and the pancreas, something that a lot of veterinarians may have difficulty finding and are going to be concerned about if they ordered an abdomen on one of their patients. Anyway, this is a second video that I'm making to help my fellow sonographers avoid some of the obstacles and bureaucracy that I have hit. It has taken me almost 6 weeks to get a radiologist to supervise my company. So we should go live at the third week of this month, where I can take Medicare and Medicaid patients and start generating a revenue stream, accepting, and then after that, once the paperwork is finalized with Medicare for me and my company, pardon me, I'll receive a Medicare number, and with that, a providership number, and with that, I can apply to be a provider for TRICARE and try to help my fellow veterans, as well as other insurance companies. Just like for humans, there's teleradiology. It can be expensive. Ultralink is approximately $2,500, which is a cloud-based teleradiology, cloud-based PAC system. And there's Vitex that might be just as expensive or more, but the radiologist in this case wants to own that platform and control access to it. It's not always the case. You might have to purchase $2,500 worth of a cloud-based PAC system. I was prepared to do it. So just like we send everything to a radiologist most of the time, obviously other doctors, and we sometimes report to ER physicians and physician assistants, which isn't a problem for us. It's the same thing in veterinary medicine. Make sure you don't have to, but it's recommended that you make sure you write your report just like you would for humans and deliver it to the veterinarian. And if they decide they need to send it, then you can help them with that if you wish, or they may prefer to do their own dictation. So that's the reason I made this video today. Furthering your practice, your independent diagnostic and testing facility needs a supervisor. May take time to get a radiologist that's willing to, sign off on that. And teleradiology for both humans and animals. So the angles of insonation, pancreas, and both adrenals on dogs and cats are difficult. Without anyone showing you how to do it, good luck. You're going to need it. So tomorrow morning will be June the 3rd, and I will be going back to the Ponder, Texas Ponder Veterinary Hospital and practice the knowledge that I gained yesterday at the prestigious veterinary imaging course in Arlington, Texas. I highly recommend it if you're interested in growing your practice imaging animals. So can't think of anything else at the moment. And everybody have a great day.